Bismillahirrahmanirrahim. Assalamu alaikum. A 46-year-old man is brought to the emergency department after a motor vehicle collision. He is unresponsive and his injury include a basilar skull fracture, brain contusion, fracture of ribs 7 and 10, pneumothorax on the right side and pelvic fracture. After multiple blood product transfusion, placement of a chest tube and pelvic fixation, the patient condition stabilized. On the 5th day of hospitalization, he is minimally responsive and has spontaneous respiration. Examination showed diminished bowel sound and facial grimacing with palpation of the right upper quadrant of the abdomen. Rectal examination demonstrated no abnormalities. Nasogastric tube aspiration showed retention of gastric content. Abdominal CT scan revealed gaseous distension of the small and large bowel without air fluid level. The gallbladder is distended with no gallstone. There is a small amount of cholecystitis fluid. Which of the following is the most likely cause of this patient condition? So this patient is 46-year-old man. He having motor vehicle collision. He was brought to emergency department after having polytrauma, which include a basilar skull fracture, brain contusion, fracture of the 7 and 10 ribs, and pneumothorax on the right side. Examination show facial grimacing with palpation of the right upper quadrant. On CT scan showed distended gallbladder and a small amount of pericholecystic fluid. So based on these, here the diagnosis of this question is Acalculous cholecystitis. And here the correct option is choice A. Acalculous cholecystitis is the acute inflammation of the gallbladder and the absence of gallstone. It is most commonly seen in critical ill patient, as this patient having multiple injuries on and palpation of the right upper quadrant. There is facial grimacing, and imaging revealed gallbladder distension, wall thickening, and pericholecystic fluid without gallstone support the diagnosis of acalculous cholecystitis. Come to the incorrect one. So patient having duodenal perforation will have sign and symptom of peritonitis, for example, abdominal rigidity, rebound tenderness. Choice C, mesenteric ischemia. So patient having mesenteric ischemia, there will be pain out of proportion to palpation, and the patient will have the sign and symptom, and the patient will have risk factor, for example, atherosclerotic, older age, and the patient will have the atrial fibrillation history. Choice D, pancreatitis. So pancreatitis on CT scan, there will be enlarged pancreas, parenchymal enhancement with intravenous contrast and peripancreatic fluid. Choice E, small bowel obstruction. So small bowel obstruction is characterized by abdominal distension and high-pitched hyperactive bowel sound. X-ray will show air fluid level and a decompressed colon and rectum. Thank you.